Hi, I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. What is IUI or Intrauterine Insemination, and how can you maximize your chance of success with this process? Let's try to first understand what IUI is. IUI is Intrauterine Insemination. If you pay attention, intrauterine means inside the uterus. Insemination is putting the sperms inside. So basically what we're trying to do here is tracking your ovulation. Basically, when the egg is growing, a few scans are done to see if it's growing at the right time and the right pace, and the right quality is growing inside the ovaries. And when it is around a certain size, in technical terms 18 to 20 mm, it is released. It comes and waits in the tube. If the tube is open and sperms are there, one sperm will fertilize the egg, and as it comes down the tube, the egg which is fertilized changes into an embryo. It becomes a 2-cell to 4-cell, 8-cell, 16-cell, something called as a morula, something called as a blastocyst, and at that stage it reaches the uterus and implants itself. So this is what is happening in a natural cycle. Now in intrauterine insemination, what we're trying to do is exactly mimic everything, the first half of what I said, which is growing the egg, making sure it has been released. In the second half, especially about the sperms, what we do basically is collect the semen sample from the partner or husband. We purify it in the laboratory. There are many processes. They are called sperm wash. Basically, the semen, the debris, the other things from the semen is removed. Only sperms are taken and with a very thin tube are injected into the uterus. Because the distance is reduced by half, what is happening is that the sperms reach the tube and fertilize the egg. The chance that they fertilize the egg is much more increased. So that's what is happening in intrauterine insemination. Now, how can you increase your chance of success? Intrauterine insemination is also of 2 or 3 varieties. First one is a natural cycle IUI, is where your egg is growing on its own under the influence of the hormones that is released inside your body, and it ovulates and it waits inside the tube, and that's when we do IUI. Now how do we know it's waiting? We keep doing regular ultrasonographies. These reveal that the size is big and it has ovulated, it's in the tube. We can't see it's in the tube, but we can definitely see that it has ovulated, and that's when IUI is done. 36 hours after the egg is ovulated, IUI is recommended. Now that's the first kind. Second kind is giving you some kind of tablets. This is called as clomiphene citrate, and it gets the growth of the egg under our control. So we give you these tablets. These medications are given for a certain period of time, sometimes just few days, and the ultrasonographies are definitely done to see if it's responding properly, and when the egg is of the right size, it releases itself and waits in the tube, and that's when IUI is done. So this is IUI with clomiphene citrate. The third variety is IUI with controlled ovulation stimulation. Now, in addition to clomiphene citrate, in this kind of a process, injections are also given. Hormonal injections are also given. FSH, HMG, human menopausal gonadotropin is added. This is definitely to be tracked with regular ultrasonographies. What we are trying to do here is increase the dose of hormones that the brain is producing, yes, but we are increasing it so that 1 or 2 more eggs grow in addition to the one that grows every month, and the ultrasonographies make sure that the size is increasing according to the dose that is given, and when it is of the right size, an injection is given to make it ovulate. So everything now comes under the control of the clinician and the patient. When the injection is given, 36 hours later, the egg ovulates and waits in the tube. That's when IUI is performed. Now, these are the 3 varieties. One is natural cycle, second is clomiphene citrate with IUI, and third is with injectables, with hormonal injections which are given to maximize your chance of success. Now, what is the procedure where you can maximize your success? The third one, where hormonal injectables with clomiphene citrate is done when IUI is done, will maximize your chance of success, because this will ensure that 1 or 2 eggs are growing and we are under the control of ovulation timing, and we can do IUI at the right time so that your chance of success increases. The most important factor for any of these procedures to work is the sperm count. If the total motile sperm count is more than 10 million, only then we are optimizing the whole process. So it's very critical that the post wash, that is after the procedure where we are processing the sperms, the total motile sperm count should be more than 10 million. That's when maximum number of sperms are available for the egg, so that the best sperm reaches the egg and fertilizes it. If you want to understand more about IUI, if you want to get an IUI done or have failed at previous IUIs, you want to understand the reason and want to explore more options, please feel free to contact us on the number that you can see on the screen. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.